Hello, I am from Bangladesh. I have come to Bangalore, India with my son for his sagittal craniosynostosis surgery. After coming to Bangalore, we have met Dr. Rajendra and his team, Dr. Alok and Dr. Shishir. They have diagnosed the disease and they have done a very good surgery for my baby. We are very grateful to the doctors and to the hospital and all the supporting staffs and international coordination office for their support and cooperation. We are grateful to it. Thank you so much.
Hello, I am Dr. Rajendra Gujjalanavar, HOD and Senior Consultant Plastic Surgery at Sakra World Hospital. Today I am going to tell about a patient, 18-month-old child who came from Bangladesh with a history of a long head, and both the parents were worried. Patient born normally, but over the last 1 year they start seeing patient's head is becoming longer from front to back side. So they were very anxious when they presented to us. So when they came then with a multidisciplinary approach, so we evaluated the patient. First we did a complete thorough examination, history, clinical examination, and other departments. We evaluated the patient. So we found to have a patient is having a craniosynostosis of a sagittal sinus. The craniosynostosis is a condition where there is a early fusion of the sutures of a skull, meaning normally in the skull there are gaps which between the bones, which makes us skull to expand when a brain grows. So by birth, if it is fused, it is not open, it restricts the growth of the brain, and at the same time it causes abnormal shape. And this child was having a similar condition of a sagittal sinus craniosynostosis. After examination, we did a CT scan and 3D model. So we found to have a sagittal craniosynostosis. This is his child's skull. This is replicated from the CT scan. If you see, his head is quite long. This is a sagittal sinus which is fused. Because of that, brain is growing front and the back side, and it is not expanding in the center. But that's the reason he is having a longer head, and both sides is pointed, and this is also restricting the brain growth. And when we evaluated, patient was having a increased pressure inside, which was causing a compression on the brain. So after complete evaluation with a discussion with a neurosurgeon and a pediatrician, so we decided to go for a surgery. It's called a cranial remodeling. It is a very complex surgery considering the age of the patient. So with the help of our pediatric anesthetist, Dr. Shishir, we took a patient for surgery with all precautions, and this surgery took around 6 hours. Patient was doing very well. It is done by plastic surgeon and a neurosurgeon, and patient all with the help of a complete anesthesia team. Surgery went well and patient was stable, and patient was shifted to ICU a day and shifted to ward in the next day. So it was a complex surgery where what we did a complete opened the complete skull like this, and we shaped it. His head, if you see, his head is long, and also this forehead is very uneven. So we removed all the bones of the front and the back of a bone, and we molded and fixed it in such a way that he should get a good shape, and at the same time it allows the brain to grow. So a patient was in a hospital for 5 days. All post-operative period was uneventful, and patient was very happy. So now patient is doing well. If we see, his head is almost round shape. His intracranial pressure has come down with the examinations. Now patient is ready to go home happily. And these are complex surgeries where we need a multidisciplinary approach where many departments are involved to get a best results. Thank you.
When both parents and the child met me in my office for the first time, I could understand that they were highly stressed and anxious about the ongoing or the upcoming surgery, which is entirely understandable. A surgery of such magnitude in a small child comes with a high degree of risk and trepidations. This is exactly where a hospital like Sakra would be an excellent choice, because we have a strong multidisciplinary work culture here and significant experience that we have accumulated over the past decade of managing such complex cases. From an anesthesia point of view, this was indeed a challenging case with a small child posted for a big and supramajor surgery. Major concerns included airway management, management of blood loss and replacement of blood loss in the operating theatre, post-operative intensive care, and pain management, all of which was accomplished very well by our team. So I'm very happy to know that the child is doing well and has had a successful outcome. I think it's really important to spread the awareness of craniosynostosis among parents and pediatricians so that these children can get access to tertiary centers like ours early, so we can get the best possible clinical outcomes for such children. Thank you.